Good morning, everyone. Good morning. Let me make Carol a panelist. Let me turn up the volume, make sure everybody can hear us. There we go. Can you hear us okay, everyone?
Yes.
Okay, wonderful. Good morning, Dr. Kumar.
Hi, good morning.
Maybe you're ready to talk, or Kimberly.
Is the time already?
It is.
Oh. For some reason, I thought it was a little earlier. Hey guys, I haven't been feeling well the last few days. Okay, so we're gonna go ahead and call this meeting to order. It's 10:31. We can have roll call. You need a roll call?
No, but we have a
Okay.
quorum.
Okay.
Mhm.
Okay, so item B, approval of the agenda.
Don't move.
Okay. Is Carol participating as?
She is, her address is on the agenda. She is participating.
Can you hear us all right, Carol?
Yes, I can.
Would you like to second the approval of the agenda?
Yes, I second.
Okay. All in favor?
Hi.
Okay. Aye.
I
Opposed? None. Item C, meeting minutes. Any questions on the meeting minutes?
I'll move for approval.
second.
Okay. All in favor?
Aye.
Aye.
I
Okay. Approved. Item D, public comments. At this time, comments from the audience may be made on items not listed in the agenda that are of public interest and within subject matter jurisdiction of the district. The committee has the policy of limiting speakers to no more than 3 minutes. The committee cannot take actions on items not listed in the agenda. Public input may be offered on an agenda item when it comes up for discussion and or action. So at this moment, I know we do have someone that will be providing comments. We'll go ahead and Dr. Kumar, instead of 3 minutes, we'll go ahead and give you 5 minutes. And if there's any further discussion, we can add it to our agenda later or have a meeting, like a follow-up meeting on it. So if you can, please summarize. I know Andrea gave us a document that you sent, but if you want to go ahead and summarize it.
Absolutely, yeah. Yeah, thank you so much. So I think we were kind of facing we were kind of very blessed by our FED bill that Lifeline. So first of all, thank you everybody for that. But we were also chatting in the back and was thinking of a different way in which we can, like a backup plan in which we can save some of the hospitals, and it was very timely. And I know I kind of designed this little document, which is just a little synopsis, but this is a new designated type of Medicare provider. It's called a rural emergency hospital, and it's actually valid. It's actually in place in several states, including my home state of Missouri. And I reached out to one of the CMOs in Florida, and they also have about 13 rural emergency hospitals. And actually, Florida is kind of leading the nation. But Medicare came up with this description in 2021, and it was just like kind of like an effort to save hospitals that were having a hard time um, like supporting their inpatient care, because inpatient care is the hardest thing for the hospitals and the most expensive because it is about like 30 to 40% wager costs and provider costs, as well as salaries and I think a lot of, especially in rural areas, because you have travel nursing and a lot of like people that are traveling to work it's a premium. And so I was thinking of this along with a couple of you guys and Michelle Finney, and I think this is something that makes sense for California. So, in a nutshell, rural emergency hospital is a small hospital that no longer provides inpatient services, although it can admit for observation or for outpatient care. So it has like a few beds and focuses on emergencies. So it kind of like is an extension of an FED, and we should never say it ever again. But I think it can help. And so again, I was kind of like researching some of if we don't have a current status, REH status in California because we don't have a state level legislature. But we have several examples that we can use to kind of propose that legislation. And I think the Association of Emergency Physicians will also have like an easier time with this type of legal and regulatory framework, which can lead to a federal rural emergency hospital kind of designation. So I think we can kind of like pull them to our side using this bill and then continue pursuing our study, which can then hopefully generate some interest and maybe pathways to support the FED. And I'm not going to go over the proposed white paper. It's just a summary of a little white paper that I kind of made just to kind of make it look like what it can benefit. But Medicare actually provides a lot of bonuses to this type of hospital, so there is financial incentive for that. I'm not keeping track of time, so I didn't know how much time I took, but that's what in a nutshell. Michelle also mentioned yesterday about the Palo Verde hospital situation, and I don't know if you guys are aware of that. Their financial losses over the last 2 years have been about $15 million, and most of it is attributed to like the salary of the travels, nurses and things like that. And this is a great example. We are actually looking into sending like an emergency bill to see if that is an option for the Palo Verde Hospital to convert into that instead of just shutting down. And we can use, if we are able to push that, then we should be able to use that as an example to push this on along with our FED bill. But that's kind of was one of the backup things that we were thinking about and is for your consideration. So thank you for your time.
Thank you, Dr. Kumar. Are there any questions or comments?
Yeah, question on, I know you're referencing Medicare. Is it Medi-Cal eligible billing too, or just Medicare?
I don't know the answer to that, but I can research it. But I know that this is there's an act called Consolidated Appropriations Act, and it came out in 2021, and it basically provides. It's a full service. Like I think it accepts everything, but I'm not 100% sure. But I can research that and get back to you.
Know if it accepted both Medi-Cal and private pay as well. Private insurance.
Yeah. Yeah, I mean, I think it's a hospital. I know that in Missouri, I know the federal guidelines, and I think in Missouri, the hospital accepts everything.
Okay.
So it's just like a normal hospital. It's just designated as a rural emergency hospital, so it doesn't have to maintain inpatients services, and so it shuts down a lot of financial loss.
Okay.
Director Rogers?
I'm trying to Google that answer for you. No, I wanted to know the status of legislation. Has it been proposed, Dr. Kumar?
No, never been proposed in California. So we're just kind of like haven't taken any action on it. And I don't think there hasn't been any opposition either. I actually Googled that.
Okay, so if we go forward with this, we'd have to find a sponsor like we did with the FED bill.
So I did some research on that. So there is a senator, I wanted to make it kind of like bipartisan just so that we have, both supports. And so Senator Brian Tall, and we can research more, but this is just my quick research. He has the most rural areas under his belt. And also Assemblymember Jim Wood is a DDS, and he's the chairman of the Assembly Health Committee, and he has worked on a lot of ER type of stuff. But again, there are probably other target sponsors, but these were just like kind of like my quick, like I was looking at demographics and what they support, and these were the two names that I came up with.
Okay, I'm reading Google. The conditions of participation of rural emergency hospitals must meet to participate in the Medicare and Medicaid programs. So that's the answer.
Yeah, they do it. Yeah, I Googled it too. They do accept Medicaid. So
Thank you for this. I will let you know that Assemblymember Jim Wood is no longer in the legislature. But then the person that's now representing that area is Chris Rogers. So, and I don't know if he sits, but we can look up who sits on the Health Committee of the Assembly. But yeah, that was some good research. What I would like add or recommend is getting hold of Tish and sharing this information with her. It doesn't mean that we would need to like ask for a whole new bill. There might be elements from this that we could work on a current bill and either like change it. We could also run it by the Senate Health Committee, Menjivar, and see if how receptive they are of this. But yeah, thank you for that. More. All right, thank you.
Thank you.
Any other questions or comments? Okay, so we're gonna go ahead and move to new business. Item E1, Governor Gavin Newsom's budget revise. Are there any questions? Anything to add? Any highlights?
No, I think thanks to whoever printed out the Assembly Senate budget agreement. I read over that yesterday. Which somewhat better than the governor's.
Quite a bit.
Yeah, I mean, especially around, and it was funny too, because yesterday at the board budget committee or budget discussion for the county, there were a lot of discussion around IHS, in-home support services. And it looks like the legislature is somewhat restoring or at least preventing some of the bigger cuts. I mean, the biggest thing as far as health goes was really the reduction in Medi-Cal for primarily undocumented individuals.
Be no longer enrolling any new participants.
No. Yeah. And like even the state, even the Assembly and Senate, they basically kept all of that. I think they changed some of the timelines. Yeah, it's not encouraging. Yeah, I mean, he was proposing, the governor was proposing the $100 monthly premiums for adults, and which most people couldn't afford that if they're on Medi-Cal.
Right.
But the legislature dropped that to $30, which is a little more palpable. So,
Pretty good summary. Thank you for whomever
yeah, whoever put this out.
put it together.
You're welcome.
Director Rogers, any questions on that item?
No, thank you. It looks like an improvement, but it's still not perfect. The rationale for insuring undocumented people was to help with the cost of their care when they couldn't afford it, and to because the taxpayers pay for it one way or the other. So it doesn't make a lot of sense, but that's just my opinion.
Yeah, and I think a lot of the reason he's doing this though is because of the federal stance and the fear of clawbacks of dollars to the state. I don't think it's right either, but from what I'm hearing, that's a lot of the rationale that they're using.
And then also his bid, President's bid.
Exactly right.
So we've seen
Exactly
him
right.
become a little bit more
Conservative.
moderate. Yeah.
Not moderate.
Okay.
I will say one last thing too, is that at least homelessness, because I know the district has invested in that before, is that he did not have any of the homeless housing assistance program dollars in the budget. The legislature did propose 500 million. It's usually been $1 billion every year, so 500 is better than nothing, but it's still not enough. So, and then also some increase in the LIHTC funding, and then also good news is that Assemblymember Wick's housing bond, it's a $10 billion housing bond, did pass the Assembly and is moving to the Senate. And in this budget, they're basically advocating for the passage of that. So that would be on the 2026 ballot. So,
Was there anything in here about, I didn't see about the Mental Health Services Act, which is now behavioral health?
yeah, no,
program?
they're primarily, that's just level funded under the Prop 1 stuff. So there's no extra stuff. So,
But nothing's been cut either.
no, and actually the county, we got allocated a couple weeks ago for 2 big projects. So for our behavioral health hospital,
Oh, yeah?
and then also for called Harmony Haven. It's out near Gadding Beaumont. It's for transitional age youth. And then it's actually be an expansion to another like wellness village out
Oh,
there.
wow.
Yeah, we got $130 some odd million for both projects. So
We need you to have you come to our policy, our behavioral health collaborative meeting and get some updates.
oh yeah, definitely. Yeah.
All right. Any public comment on the item?
No.
Next one is E1A, which is also, I guess, well, it's part of the same, May revised memo. We also have, Health and Human Services, Behavioral Health Infrastructure Investments in Medi-Cal and budget demands. Any questions or any comments on that? Yeah, this is pretty good information, and I'm glad that we were able to, add it to our agenda. Okay, so item E2, SB 827, local agency officials training. You wanna provide a quick like summary of what it is? I read it, and so my understanding is that it'll be, I guess, like asking board members and to do like another special training aside from ethics, which would be on like financial management. Senator Gonzalez. What I did not do, I did not look for the status of it, so I'm actually not sure. how it's
That's
doing,
correct,
but-
what you said. It is,
Mhm.
currently there's, every 2 years, local agencies as well as, other government bodies must take, a 2-hour ethics training. And this particular bill also, recommends fiscal training as well
Mhm.
with that every 2 years. But I believe, Jeff's gonna give a more detailed update at the board meeting.
Okay, are they asking, or is it something that we'd like to support? Or,
I guess that would be.
I have a question. Is that fiscal training just for staff or is it for board members as well?
No, all of this is related to local government officials, local
elected.
agency officials.
Yeah, elected officials.
Yeah, but it calls for financial training.
Mhm,
For local officials.
like fiscal management.
Is it just for management or is it for board members?
Board members.
For financial training, fiscal and financial training. Okay.
My internet's a little slow. I'm trying to pull it up.
Yeah.
Right. So, but we already do fiscal or ethical training. So this would be along the lines of, I'm not quite understanding what the description of fiscal and financial training is. I mean, is it how to read a balance sheet or, any idea what it's about?
Those are great questions, Director Rogers. And I'd be happy to communicate with the author's office to see if they have a fact sheet or something a little bit that's more like a user friendly.
That would be helpful. I mean, I agree that fiscal and financial training for board members would be needed. Is that local agency officials? Does that include staff?
I think it's mainly how I'm reading it. It's mainly for like boards, and it talks about like local agency officials. So it would be for like special districts, cities.
Mhm. Yeah,
And
got it.
as it's referred to the
That's
committee.
a great idea.
You just never know where this is. Sometimes it's like works on the spot and like super fast, and right now it's like taking it.
It does describe What is considered fiscal and financial training on page 131 of the packet? So it's page 5 of this bill. 2.4.6. Thank you, Aaron.
Yeah, they mentioned a department head or other similar administrative officer of a local agency, an employee designated by a local agency. Going forward to receive the training.
Financial administration, right? Financial policies.
Financial reporting and auditing. Mhm.
Mhm.
So this is not an item, like an action item,
Yeah.
but I mean, I wouldn't be in opposition and like recommending maybe like a letter of support.
Was there a reason introduced?
Yeah. Dr. Kumar has a question.
It's probably somebody, you know, fiscal
You
mismanagement.
guys found it.
Yeah, exactly. I mean, it's
Yeah.
not, I mean, reading this, it's not really anything more than what we already
Mhm.
do.
Agree.
It'll just be another 2 hours instead of.
Yeah, it's just
Aside
a
from
formal training
this-
outside of what we already do on our financial updates and all that.
Right.
It's a one.
Might have helped our local school district.
Yeah.
Yeah, or city homes.
City homes.
To the
Steve-
career work.
Or career work,
Yeah,
yeah.
right.
yeah, yeah.
I'm not sure, are there any other comments or notes from Jeff on this? Bill, or?
Did we agree to support it?
I would just say we stay neutral and just
Mhm.
see what happens. I don't think it affects us.
Then we could hear from Jeff
Jeff
at the board meeting, what he
Yeah.
feels.
Yeah.
Or if he has any information on other, like, other agencies or
Yeah.
wondering if, what the Association of Healthcare stand on it is as well.
Or even like League of Cities or
Mhm.
that too.
Mhm.
Thank you. Any questions or public comment on this item?
I think we're good.
Alrighty,
Chair Barroso, I just want to go back for a moment. We have, Chris emailed just a little legislative committee, for the committee, the update from Tish, since she wasn't here today. Let me share this with.
I guess we can congratulate Senator Limon. She's,
Oh, I didn't know that.
Oh, that one,
Uh-huh.
too,
yeah,
Yeah.
so.
my understanding is that our local senator, one of our local senators was eyeing that. No, but yeah.
Oh,
Uh-huh,
Oh, they can't see this one. So let me go back.
uh-huh.
Oh, there we go.
I didn't see that yesterday.
Mhm.
I think Chris
I think it
emailed
was
it this
just-
morning.
I think it just came out, they just,
Oh,
this morning, so.
And then she had some other updates, I think that everyone was.
Kind of recapped a lot of the same,
Of the,
Mhm.
yeah.
budget update and that.
Some other bills as well, and so I mean, we have a few days before they have to vote on the budget.
There was
Yeah,
some
and then she does give some next steps regarding the
IPD.
588 there.
Mm-hmm.
I think, I mean, to your point earlier, is I think it might be worth doing an amendment to it to include the rural, like, because since it's just a study.
Yeah.
Is that
see
include the
what would
rural
work.
hospital designation, that might soften it for the opposition, if we
Mhm.
gave, if we had two options to do a study on. And I may be
Yeah.
wrong, but
That, and then also that maybe sometimes it's the word like FED, like they're just like, we don't
Right.
wanna do that, right? And
right,
oftentimes it's like, well, let's just change the definition a little or
Yeah.
incorporate of other elements to the bill and it'll go through a little bit easier. Yes, so I mean, I agree, we should be meeting with them. I think we should also meet with SEIU, because I don't see them just, like I could also see them being in opposition to something like this that's being suggested. So, yeah, I think that we should, we can schedule a meeting with her. I know that you meet with Tish regularly, Chris. If you can add me to like one of your next meetings and then start scheduling. We need to determine how quickly Senator Trouble or how soon she wants to like go back to working on this, since it's a 2-year bill and she has other things to do. It might not be at the top of her priority. Because like she really can't do anything until next year. So we're still looking at like a half a year. I think that we can continue doing some work on our end to try to like beef up this bill or try to, make it better. And of course, continuing conversations with her office, but again, I'm not sure how much of a priority it would be. They will be going into a summer recess soon. And so there might be some like opportunity to like meet with her, connect with her here locally. If that works, some like in-person meeting. And then and so yeah, let's share this information with Tish and see what she thinks, and we can maybe have her incorporate some of these elements into the bill. And then eventually we would send it to Ledge Council for like a revision and see if it works. And then they'll send it back to us to see if we're in agreement. Okay. Any other comments or questions?
When does the session close?
In September.
Sometime.
Mhm. Late August or September, it changes, it varies from year to year. But it's typically like the last week of August, first week of September, and then the governor has 30 days to vote on bills, approve bills. I see Director Rogers has her hand up.
Yes, thank you. I just had a question of Dr. Kumar about his contacts with California emergency physicians. Is because, he's such a strong advocate of this bill that maybe we could involve him.
Question for me? Sorry, I missed that part.
Yes, yeah, it was a
Okay, sorry.
question.
Yeah. Okay, yeah. No, absolutely. And I was actually able to talk a little bit. I was there for a different bill which passed, and I actually learned from how they executed that. So I was thinking a three-pronged strategy. I'm having just very early stages, but I'll disclose it here. But I'm having a meeting with Michelle and a few other key players to discuss like how to save the Blythe Hospital, because it can become Riverside County's problem if they flip. And one of the things is that to use like an emergency bill to like, that's the first step to like actually introduce this kind of idea, is like use that as a pilot project and see if we can convert that into a rural emergency hospital. I do want to say that I want to make sure that we keep these two things separately. The reason I think that's important is because I just don't want like this sinking ship to take down this one as well with it. So I think if we keep it separate, then at least one of them will pass, if not both, And I think we just build bridges. I think the first one, we try to do this emergency thing for the Blythe Hospital and then use that as an example to push the rural emergency hospital designation bill. And when we do that, we network with everybody that was in opposition for FED, and that'll be a great way of improving repo and like getting goodwill. Once we get that, then we can have the FED. We can have discussions and see what their objections are. Do they even understand the bill? Because my understanding from witnessing that hearing was that they didn't even understand it. We were talking about two different things. Like they were thinking that a Texas model is all they can think of, and the Texas model is very bad. But we're not talking about that. We're talking about in health provider shortage areas and rural areas. So I think once they understood it, after the session was over, they were like, oh, we didn't realize that you guys were talking about this. So I think we had some common grounds after the session was over. And I think it'll be a good idea to like approach them for I don't think anybody opposes rural emergency hospitals, and then use that as a stepping stone for the FEDs is what I was thinking. But yeah, 100% agree. I would be happy to network.
All right, thank you. And if you could keep us posted on that conversation with the Blythe Hospital, we'll be having a conversation of our own a little bit later. Go ahead, Dan.
Perhaps, may I ask a question?
Sure.
Palo Verde is a designated healthcare district hospital, so does that have anything to do with the health and safety code? I mean, is it something ACHD should maybe be involved with as well? They're looking to converting it to an REH. I don't know, I don't know if there's rules and regulations, because it is a healthcare district
It is,
hospital.
I only know, I haven't really like looked into it too much aside from what's been on the news. But I think it's worth, it's valid if we do communicate with them and see, try to help them in that. That is a conversation that we're gonna have a little bit later with Director Rogers and Chris staff to see how we can, or if there's any way that we can help them, and I'm thinking even aside from like financially, since they're in their own healthcare district, if it's how do we support them right at the state level? How do we support them with like the association or I mean, it might be a little bit too out there, but is there maybe a way of us expanding our district to like encompass them or a merge or like healthcare districts? And I think that would be beneficial. But I mean, we still don't know. And I think that there is an urgency. I mean, and so I know that some of these other options could take some time, but I think that in the long run, if the hospital does go down, we will be affected. And it's not only that, like the main priority is the people, the residents that live in that area. But I know that we would be impacted as well, being their neighboring healthcare district. So we'll see. Hopefully we're able to support our neighbors, be like State Farm, be a good neighbor.
Yeah, he's pulling out of California.
Alrighty, so any other questions or any final board member comments, committee member comments?
Yes, I had a comment regarding the bills that were submitted to us at the last meeting. Did we just decide that we were going to come out and support any of them that were given to us?
I know we had talked about the budget request for 211 that Senator Trumbull had requested. And actually, I don't know. I didn't see it. I'm not sure if I don't know enough. I don't have enough to even see if she's heard back from like committee to see if they'll be getting funding for that. But that was one of them, I know for sure, that we wanted to like, keep track of.
Okay, thank you.
You're welcome. Alrighty. Any other comments, Greg?
No.
Alrighty, well, thank you. We're gonna go ahead and adjourn this meeting at 11:02. Thanks.
Thank you, Betty.
Thanks,
Thank you,
Dr.
Doctor.